Kushe, and good afternoon, everybody. This is John Lasher, and today is Wednesday, April 8th. I thought it was important to keep everyone updated on where things stand, both in the country and with PIH as it relates to the coronavirus response. So, as everyone knows, about 8 days ago, Sierra Leone registered its first positive confirmed COVID-19 case. And today, this morning, President Matabio addressed the nation, letting us know that there was a seventh positive case in the country. So there are currently 7 cases. 6 of those cases were travelers who had been quarantined, and 1 has no known contacts. And as all of you know, we just completed a 72-hour lockdown. And I know there's been a lot of rumors about whether the lockdown would be extended. Today, we are no longer in lockdown, and the president urged everybody to stay home this morning, but the country is open. So as an organization, we've been taking steps to both protect our staff and to keep our operations running at KGH Wellbody, in Laka, at Kissy, and in Port Loco, and with our community health worker program. So right now, for our administrative and support staff at the offices, both in Kono and in Freetown, we have reduced who we're asking to come into the office. This is to minimize the amount of time people are leaving their homes and taking public transportation. Those who are coming to the office in Freetown are being picked up in PIH vehicles, and there are only a handful of people who are asking to come into the office. In Kono, our clinical operations are continuing, though we have seen a reduction in the numbers of people who have been coming to the clinic and to the hospital. We were worried about this happening. This is exactly what happened during the Ebola outbreak. The good news is that our clinical team now is much more robust. It's a much larger team than we had during the Ebola outbreak. And in addition to that, our organization has many more systems in place to be able to continue providing care to the patients. So just to give everyone a breakdown of who is doing what across the country for PIH, Byler is in Kono, and he is the point person coordinating all of the different response efforts and preparation efforts in Kono. So he's been attending the District Emergency Operations Center meetings, and he's been liaising with several other leaders across PIH to organize our planning. The first is Marta Patino and Vicky. They're planning our facility-based response and making sure our isolation units at both KGH and Wellbody are prepared. They have already received suspect patients, and all of those that they have received have been negative for COVID-19. Byler's also working with Chembe to coordinate our community-based response, and he's also working with Amadou to coordinate the operations planning and response. So in Freetown, Momo Jimmy has been attending all of the Emergency Operations Center meetings, and Marta Lotto has been coordinating from the case management pillar all of the clinical trainings and doing direct patient care for the confirmed positive cases in the country. We're also monitoring the situation in Guinea. Today, they confirmed 144 cumulative cases, so total in the country, there are 144 people confirmed with coronavirus. In Liberia this morning, they had registered 14 cases, but they expect that number to almost double today. And obviously, we have a PIH team on the ground there who are working to support the government. I also wanted to hear from Dr. Byler to give you more specific information in Creo about what's happening in Kono and steps we can be taking as individuals in our communities to stop the transmission of COVID-19. And then we'll hear from Marta, who's been training doctors and nurses in Freetown to be able to treat coronavirus. I want to thank all of you for your patience and flexibility during this moment. I know it's a very anxious time for you and your families, and we're trying to provide as much support as we can. Though many of you are working from home, I want you to know that we are committed to the mission of this organization and making sure that our patients have access to the same services they had before coronavirus. Now to Dr. Byler. Byler, if you could give an update of what's happening in Kono district around the coronavirus response, that'd be great.
For the COVID response na Kono, so far we get about 7 alerts, wey mean say na 7 people and they don't call for investigate, and they able to investigate 4 of them, and all negative. They don't get Ebola, so no get no COVID-19 at Kono yet. But like what we they do in terms of preparedness at the DEOC, now for try for set up a 3 level of treatment. One for people that were severely ill in case you get corona. Then the one that were mildly sick, we put them in a hotel them or the stadium. So far, then in terms of that, in the hospital we get PIH and the hospital management don't set up one isolation unit where right now they take maximum of 2 patients. And also, we don't work on the triage system. We're now on a 2 level of triage. Where the first one about differentiate between the other and get respiratory symptoms and the other they not get. Then the other and get respiratory symptoms now. Then they try to screen them more if they get suspect COVID or not. So now the hospital well set and also well body. We also get an isolation unit there, and also the staff that don't train. Thanks to Dr. Chembe, they don't train the staff then at KGH, they don't train the staff then at well body. So in terms of the corona, I go say we there on the way for get very prepared now, Kono. So now let me get hotel to staff then. So now thank you.
What recommendations would you make to PIH staff and community members that might be listening?
So I will say we don't talk to a lot of the times waiting staff them for do for make sure say they prevent themselves from getting COVID. One, wash your hand always with soap and water. Now any station, you find out say for Ghana office now, bucket they for go well body for go now hospital. Do you not dodge, you not feel lazy, una wash una hand with soap and water. Also, if you get symptoms, you feel sick, no can walk. Call, let them go see, and then go investigate you and treat you. If you don't get COVID, you will continue to stay home if you're not well. Also, when they say people, because staff they meet me, hey, one mask. We not get evidence or show say mask where they wear out, you know, sick or whatever go prevent you. So we know they give staff the mask, but they will not say when you sick, you get fever, you get cough, you get difficult breathing. Report, let we bring you to hospital, let we take care of you. So what I will tell to staff there is also reduce gathering. When I reduce gathering, like for example, get a boku, when I talk about football, when I talk about something, then they will stop. Now for yourself, your well body, and also your family well body. You will not say this year away take you can also spread to your family or the people away you love one day when I in a house. So the advice you do una make sure so una avoid waiting for avoid and try to take them precautionary seriously. And the other thing back, we try to discourage to stop them when they take public transport because they're crowding. So would they beg to stop them, una be careful and una try to prevent yourself from this corona. Thanks.
Okay. Thank you very much, Byler. I appreciate it.
Okay, thanks, man.
And I'm here with one of the world's leading Ebola experts, who happens to be Partners in Health Sierra Leone's Chief Medical Officer, Mark Delado. How are you?
Hello, good morning. I am good.
Can you talk a little bit about what you've been doing over the last week?
So Sierra Leone has been until now quite lucky in terms of not having cases. So we were working on the preparedness for the first cases while the outbreak in China, Europe, and also US were happening. So we still had a little bit of time to prepare, but what I was involved with the Ministry of Health and the emergency response team from the government is preparing the country for the first cases of coronavirus, of COVID-19, to be able to set up like a strategy of identification, isolation, containment of the disease, and also putting things in place if we get to a community transmission and a big outbreak scenario like we are seeing in other countries.
So in Sierra Leone, there's a lot of concern about this, largely because of the experience during the Ebola outbreak. Can you talk about the difference between Ebola and the COVID outbreak?
So the two main differences that we are seeing is that definitely COVID-19 is more infectious and more contagious than what we experienced with Ebola. The R0 is higher, so it means that more people get infected from one person. And that also means that it's spreading faster than what we lived with Ebola. So we don't have much time to prepare like we did with Ebola, being able to set up things as they were happening. And the second big difference, which is in the contrary way, is that COVID-19 is producing severe disease, like critically sick patients, in just like 15 or 20% of the cases. No, compared to Ebola, that was almost everyone got critically sick. And with COVID-19, we are seeing like a fatality rate around 3%, when with Ebola, here in the country, we had like around 70, or even in some times of the outbreak, 80% of the people infected died. So these are the two main differences, like the transmissibility and infectiousness and the mortality or severity rate. And these are the things that are, for now, making our response a little bit more complicated, because we need to move away from our previous beliefs of Ebola. So I've been supporting the case management pillar from the day one that this preparedness started, and we have been extremely privileged to have right now our chairman, Dr. Steven Sevali from 34 Military, and what we are working right now is in trying to set up all the hospitals in the country and health facilities should have some kind of isolation room. So then if they find somebody with symptoms that could be COVID, could be isolated and tested. We are setting up 4, even 5 treatment centers in the country, mainly for mild cases, because if they are not in need to be in the hospital, at least we need to set up some facilities where they can be admitted, they can be separated from the community while they are infectious, but they don't need to have hospital care because they are not really sick. They are going to be mild sick, or even many of them, they don't even have any symptom. So the only thing is that we should, while they are positive, we should isolate them from the rest of the community. And also we are preparing 1 or 2 big treatment centers prepared with all the most modern technology, highest standards of care for critical care, even with ventilator, ICU, and all the systems that we need to have for being able to deliver critical care for these 5% of people that are going to get quite sick. So then we can give them the highest care that we can. So this is what we are working right now with the case management, is setting up the prevention, the identification, and also the treatment of all the cases, mild, asymptomatic, and also severe cases.
All right, and really the last question now. Have you seen the patients who are sick with COVID in Sierra Leone, and how are they doing, and how are the clinicians who are helping them prepared, and how is everyone doing?
So right now I'm working as one of the clinicians in 34 Military Treatment Center. We are 2 doctors, Dr. Reginald Colt and myself. We have some support of 2 of the Chinese soldiers from the Chinese army that is working in 34, one intensivist and one infectious diseases. But I am one of the doctors who is doing the daily rounds to see the patient, checking on them. They all are doing amazingly well. Most of them are completely asymptomatic right now. They don't even have fever, no cough, no sore throat, nothing. They are even complaining that they are bored, they want to go home because they are feeling super fine. So the problem is that this is a sickness that it needs 2 weeks more or less until you become negative. So while you are still positive, you need to be isolated from the rest of the community, no? But we are doing the rounds every day, 3 times a day, morning, afternoon, and night, and all of them are very stable. And as I said, the majority of them are completely with no symptoms.
Thank you for your time. I'm going to let you get back to your training. Thank you, Marta.
welcome, and be safe, everyone, and please transmit the information that we were talking. Wash your hands, avoid the masses and the social activities, keep the distance with people, and if you are sick, isolate yourself and report to the authorities, and don't touch your face, with mainly especially in the eyes, the nose, and the mouth. Please stay safe and wash your hands.
Thanks, Marta.
Take it,